Discover the latest health tips, expert advice, and inspiring stories. This is the Health Channel Podcast. Your journey to better health starts now.
Back pain is extremely common, and women of all ages experience it in ways that just aren't discussed enough. From pregnancy to childbirth to menopause, women's bodies go through spinal stress that most men will never experience. Today, we'll be talking about some of the lesser-known causes of back pain in women, and we'll answer your questions on this episode of Ask the Doc, No Appointment Needed. Welcome to Ask the Doc, the show where we encourage our viewers to send in their health questions. I am Dr. Georgiy Brusovanik, a minimally invasive spine surgeon. Let's start things off with a Facebook question from Katrina, who asks, "Hey, Dr. Bru, I sometimes get back pain, which I usually associate with my monthly menstrual cycle. But as a collegiate athlete, how can I tell if it's my period or something else?" Hi, Katrina. You're coming right out the gate with an excellent question. So you got to make sure that it's not endometriosis. You got to make sure that it's not something that is truly related to your cycle. And you got to trust your senses in that if you believe that there's an association between your periods and back pain, then there is an association. So give your doc a chance. I would speak to both your spine specialist and perhaps your OBGYN specialist to see if there are some quick tests that you could run, such as an ultrasound or perhaps a pelvic MRI. Great question. I appreciate it for all our viewers. Our next question comes to us from Tiana, who reached out to us on our YouTube page. Tiana's question is, "Hi, doctor. I began fertility treatments a few weeks ago, and I've suddenly begun having some back pain. There's no correlation here, is there?" Hi, Tiana. Thank you for reaching out with your question. As crazy as it may sound, there could be a distant correlation. So, theoretically, taking hormones may have an impact on your ability to form clots, both preventing clots and making your body create clots more commonly, easier. So there is a reason for you to mention a worsening back pain to your doc if you are indeed having so, but it's possible that it's also coincidental. And then, like everyone else who has back pain, it's important to get a proper diagnosis and evaluation vis-a-vis an MRI so that you can truly understand why you are suffering and what is the cause of your pain. I hope this helps. Next question comes from Demetrius. Demetrius reached out to us on our YouTube page, and his question for me is, "Hi, Dr. Brusovanik. My incredible wife is a few months pregnant with our first child. My question is this: why does pregnancy strain the spine so much, and what can I do to help alleviate some of the pain?" Demetrius, thank you for reaching out with this particular question. Congratulations on your wife being pregnant. You have a real blessing, and what your wife is experiencing is not uncommon. I have a list of common things that need to be considered when a woman, especially a woman who is pregnant, has back pain. Please take a look. Pregnancy is a common one. Menstrual cycles can cause back pain via a few different mechanisms. There are gynecological conditions such as ovarian cysts, as well as uterine lesions that can cause back pain as well. Structural issues as related to hormonal changes that commonly occur with pregnancy are common. And I want to mention that specifically in your case, I mean, in the case of your wife, there could be reasons for postpartum pain. There could be other causes, but specifically with pregnancy, there is an increase in a hormone known as elastin. Elastin makes the tissues more stretchy. It makes it so that delivering the baby is less dangerous to the mom. But that same hormone does have an effect on spinal discs. And a little known fact is that during pregnancy, besides the additional load vis-a-vis simply having to carry more weight, there's actually a reason for discs to become more leaky. Now, look, a disc is like a jelly donut. So the inner core is more gelatinous, and it's kept inside by the outer ring, the annulus. Elastin makes the annulus more permeable, and a little bit of gelatinous content of disc may sneak out and cause a wicked sciatica, which a lot of my pregnant women will complain about. It's not a dangerous problem. The problem is just that we can't help someone who's pregnant with the most common means, which would be either an epidural steroid injection or possibly surgery. It's even difficult to obtain proper imaging. But Demetrius, talk to your wife about consulting with her obstetrician about taking a short course of steroids. A 6-day course that is tapered down, meaning that you start with a higher dose and every day you take less and less, that may really help your wife. And I don't believe that it's contraindicated when someone is pregnant. I really hope this helps. Adina sent this question in via our very own website, allhealthtv.com. Adina asks, Shalom, Dr. Brusovanik, I'm pregnant too, but I'd like to know what back pain is normal during pregnancy and what isn't. I've been feeling some sharp pains occasionally. Hi, Adina. This is a really important question, and I appreciate you sharing your story with us. I think that back pain is just not normal, period. It's also very common to have back pain, especially when you are pregnant. Now, sciatica is really, really bothersome. Sciatica is when pain starts to run down the back of the thigh, side of the thigh, or towards the calf, or even the foot. And it can be associated with very annoying symptoms like tingling. Sometimes it's even associated with numbness or weakness of the extremity. So my advice to you is to jump all over this, meaning don't just sit and wait for this to get better. Talk to your obstetrician, talk to your gynecologist, and see if perhaps just a short course of steroids may help alleviate these symptoms. Remember that in pregnancy, with increased elastin, there's an increased production of this gelatinous fluid that kind of sneaks out through the layers of the disc and then irritates a nerve. So it's very common for someone who's pregnant, aside from having to carry more weight, to have this nerve irritation that we commonly refer to as sciatica. This is a really important question, Adina, and good luck with your pregnancy. The next question comes to us from Cecily. Hi, Doc. I've heard that labor and delivery can both have negative impacts on a woman's spine or back. Is this true? I'm in my late 30s and a little nervous about it. Cecily, thanks for reaching out. Look, it's true that labor and delivery are associated with a good amount of back pain. That being said, there really shouldn't be a lasting effect on your spine from labor and delivery. The increased elastin will decrease to its normal levels, and the weight of the baby will disappear once you deliver. So if you're suffering, you deserve a diagnosis. Now, a common question I get in association with this issue is whether an epidural is the cause of someone's pain. It's very common for women after delivery to report back that their back pain began with the epidural, and studies really don't confirm that. A carefully placed epidural should not be the cause of your lasting back pain. Pregnancy could be associated with having back pain, but I would not blame your epidural. Look, complications happened, and I'm sure there are unusual scenarios, but for the most part, in good hands, an epidural should not cause back pain. Cecily, thank you for reaching out. Next up, we've got another question from allhealthtv.com. You should really check out our site when you get a chance. It's chock full of great information. Viveka asks, and Viveka, I'm sorry, I hope I'm pronouncing your name correctly, asks, hello, Dr. Brusovanik, my sister-in-law, who is nursing in the next room, wants me to ask you, why does back pain sometimes worsen postpartum? So that's a great question, Viveka, and good luck to your sister. I'm excited for her. You do hear stories about worsened back pain postpartum, but what happens postpartum? Women carry babies, heal from the delivery, and much worse so from a C-section. with a C-section, a common injury to the abdominal muscles will result in this hyperlordotic posture where, while carrying the baby, you sort of hyperaccentuate extension so as to lessen the weight of the baby. You hold the baby dear and you bend backwards, and that in itself can cause common back pain, such as with irritation of the joints in the back of the spine, commonly referred to as facetal pain, and it can also be associated with disc-related pain, which can cause sciatica. Viveka, I would encourage your sister that if she does have back pain after delivery, there's definitely solutions, and she does not have to keep suffering. Thank you for this really important question. This next YouTube question comes to us from Archer. Hi, Doc. What role does bone density play in women with back pain? And are postmenopausal women at higher risk for damage because of low bone density? Archer, I think there are a couple of things that I can add to this video that may be relevant. First, I definitely encourage my patients to have a bone density evaluation early in life. About once a year, I catch someone who has low bone quality and they aren't even aware of it at all, meaning someone who is way outside of the standard deviation. Now, as a spinal surgeon, I perform a lot of disc replacements for patients with back and neck pain. And specifically for back pain, in patients who want that procedure, bone quality has to be very good. So I've been seeing more and more patients younger than expected with poor bone quality. The second question, the second issue, the second point that may be relevant, Archer, is that diet alone is not enough. And on an optimistic note, if you do find that the bone quality is low, especially in women, but this applies to men as well, you are no longer limited to medications that simply slow down bone loss, meaning that now we have medications that actually help you build bone. Now, some of these are hormonal medications, so it's important to have a discussion with your rheumatologist or perhaps your primary care doctor about the risks. But I just want to tell you up front that the risks are not high, and if it lowers the risk of a fracture precipitously, it may be worth it to tolerate those risks. Most of these medications are delivered via an infusion, so I would encourage you to talk to your primary care doc as well as possibly your rheumatologist. Welcome back. Delilah just sent us another YouTube question. Delilah asks, Dr. Brusovanik, are women more vulnerable to certain spinal conditions, and if so, which ones? Delilah, that's such a good question. Thank you for reaching out. I think that there are two intelligent things that I can tell you on this topic. First, women are more vulnerable to osteoporosis, especially after menopause. So it's essential that women check their bone quality early in life, and if the bone quality is outside of the standard range, that they get treatment. The second thing is related tangentially, but there is a sufficient evidence, including a recent analysis performed through Harvard University, that when women complain, their complaints are often ignored. And there are various societal reasons for this, which are less important than the actual aftermath, which is that many of my patients, moms especially, when I ask them, when was the last time you remember having no pain, they'll start to cry and they'll say they don't remember. It has become acceptable in our society to have back and neck pain, probably because treatments up until maybe a couple of decades ago were really terrible, and we had no way of finding out the true cause of back pain. Well, this is no longer the case, but the societal issue persists. Many women, especially after delivery, will do an amazing job at taking care of their kids, all while ignoring their complaints, their own pain. So, Delilah, I would encourage you and all our listeners, if you're in pain, you need an evaluation. You need to know why you are suffering. You need a diagnosis. Once you have a solid diagnosis, then it's easy to get treatment and get better. Back pain is no longer this nebulous unknown. And if you're suffering, you don't have to suffer. Seek help from a spinal specialist, get an MRI, and start with an evaluation. I hope this helps. Okay, our next spine-related question comes to us from Haley, who reached out via Facebook. Haley asks, "Hi, Dr. Brusovanik. How common is back pain in women going through menopause, and what myths about that should be debunked?" So, Haley, that's a really, really good question. I think that back pain is severely underdiagnosed. I think that a lot of people live their lives thinking that back pain is normal, but it's not. So menopause is a trying time for women. There is a lot of dysregulation, a lot of changes, and aside from me harping on the bone density issue, it's important that whether it's menopause or not, if you have back pain, that you are evaluated. Back pain, menopause should not be blamed for back pain in itself. Our life does enough to us to be blamed for back pain. Discs degenerate in everyone. And no one, including women who are going through menopause, deserve to continue to suffer. I hope this answers your question. Welcome back. Suki via allhealthtv.com asks, "Dr. Brusovanik, what everyday routines are most responsible for back pain in younger women today?" Well, that's a very interesting question, Suki. I think that especially those of us who are goal-oriented and focused on our health will look back at our lives and find specific events or specific behaviors that would explain their pain. But back pain just happens in most of us as discs age and the contour, the shape of our spine changes. We lose height. Think about our grandparents. And this process of losing disc height and becoming more pitched forwards is very much associated with back pain and is very much associated with age. Now, as a spinal specialist who takes care of professional athletes, I'll tell you that professional athletes do not have more degenerative changes than mere mortals like myself. So it's common to think, well, what behaviors are causing this plague of back pain? But the reality is that we aren't to blame for back pain. Even those of us who spend our lives on a couch do not seem to have more degenerative changes or more pain. Studies on ways of life aren't great, but in my personal experience, I would tell you that if you are in pain, you deserve to know why you are in pain. You deserve a treatment, and you deserve to go back to living without pain. Now, whether that's women or men, post, pre, or during menopause, post, pre, or during delivery, back pain deserves to be evaluated. And if it means getting an MRI and seeing a specialist, then be it. If you feel like the 70-second visit to the chiropractor and physical therapy isn't doing the trick, then listen to your senses, and it's time to get a second opinion. Okay, the next question comes from Gustavo, who wants to know, "Doctor, I'm the sole male in a house full of women, and I want to know what they can do at any age to protect their backs." Gustavo, it sounds like you're a great father, husband, and son. And as someone who lives in a household full of women, I can understand your concern. Sometimes you wonder how so much strength can come from a person much smaller than you. And women continue to surprise us with superhuman feats. That being said, I have to stick to my guns. Your lifestyle isn't the cause of your back pain. Life is. Degenerative changes or congenital changes in those who are younger. So what can they do to protect their backs? Stay healthy, meaning keep a reasonable weight and keep active. And most importantly, don't smoke. We have great evidence that smoking is associated with rapidity of disc degeneration. So if you smoke, you are asking to worsen your back pain. And in a household full of women, I would encourage those who are around you to seek a doctor if they're suffering, if they can't sit still through a dinner, if they stand up like they're 20, 30 years older from the car or from dinner table, if getting up in the morning is painful and results in sort of this flexed forward posture until they warm up, these are all signs of common pains coming from discs. And if you see your lovely bunch suffering from this, then please encourage them to seek care and find why they're suffering. Okay, the next question is from Miyuki, and it's through Instagram. And she asks, "Hi, Dr. Brusovanik, when should postpartum back pain be treated medically? I'm asking because my friend has been having pain lately, but refuses to do anything about it." Miyuki, I hear this all the time. And at the risk of sounding redundant, I'd like to say that our society has accepted a few things that aren't normal. Our society has accepted that women are going to be in pain and there's nothing that can be done about it. And that is false. Our society has accepted that life changes such as menarche or onset of period, or menopause, which is where the period ends, can and should be associated with back pain. We've accepted the fact that being pregnant is associated with back pain. And I want to tell you very clearly that there's no life event that's associated with back pain. Even osteoporotic fractures, which are a significant concern for women's health and women's backs, are events that aren't related to their lifestyle, but more to their physiology. So postpartum back pain should be treated medically immediately. If you are continuing to suffer, and especially during this trying time when you have this little itty-bitty baby and you're trying to breastfeed, now is not the time to be slowed down by back pain. There's enough pain, enough difficulty that's going on that your back pain should be addressed. And to those loving husbands that are watching this show, again, I want to encourage you to encourage your loved ones to seek care if they're having back pain. Sciatica is intolerable. And if you are concerned about lifting your baby from the crib, if sitting in the breastfeeding position causes severe pain under the shoulder blade, then you need a neck MRI. If you can't sit comfortably, if you fidget at the dinner table, if you stand up like you're 20 years older because of back pain, then a lumbar spine MRI is very, very reasonable. And if your doctor refuses to order that for you, please send in an email to the show and we'll be happy to send you a prescription. Thank you for this great question, Miyuki. We have one more question, and this time it's from Mira. Mira says, "Hi, doc. My daughter is 7 months pregnant and she's having a lot of back pain. Back 33 years ago when I was pregnant with her, I had the same problem. What saved me was a prenatal aerobics class. Could an exercise or yoga class help my daughter?" Mira, that's a really good question. And my answer to you is no. Your daughter, like so many of our listeners, needs a diagnosis. It's fine to try some yoga. It's fine to try exercises. But if after once, twice, you are still suffering, then I encourage you to seek care from a spinal specialist or primary care doc. Get that MRI and figure out why you're suffering. Thank you again for joining us on Ask the Doc, No Appointments Needed, and see you next time.
Thank you for listening to the Health Channel podcast. We hope this information has been useful. However, please remember that only your doctor can advise you about what is best for you. Do not start, modify, or suspend treatment based on anything you have heard on this podcast. Please join us again soon.